Hi, my name is Roger Reid. I'm a chiropractor and Director of Body for Life Healthcare in Paddington in London. We look after spines and necks and see a lot of neck pain and back pain, but today I want to talk to you about a special interest of mine, which is feet and foot biomechanics. So we treat a lot of athletes and gymnasts and runners and marathon runners, but these are something that happens with everyone. We all wear shoes too much of the time, and we stand on concrete most of the time. So our little muscles, our little intrinsic muscles in between the feet, in between the bones, get weak and lazy. And the statistics show that about 67% of the population has some sort of foot biomechanical issue. And in my experience, most of those are pronators. So we're going to talk a little bit about pronating and about how we look after those and how we manage those. So as a chiropractor, I'm interested in mechanics. I'm interested in the job of the foot, which is one, to be a big bag of bones when you land on it, to absorb the ground reaction forces and cushion the impact of hitting the ground and reduce the amount of stress going up into the knees and into the hips and into the back. So sorting out the feet not just helps with foot and ankle problems and Achilles tendonitis and plantar fasciitis, but it also helps with knee pain and hip pain and back pain. And I got into this about 20 years ago, 98, I went and studied some more to learn a bit more about feet and foot biomechanics and how we can correct them and how we can improve them. So I got into this a long time ago, and what I found was that it was something that helped all my back pain patients as well, and even sometimes sorts out headaches. So it can help everything. And I always say to my patients, if you've got a wonky foundation in your house, you'll get cracks in the walls and in the roof and in the ceiling, even in the chimney. All right. So my job is to see what's happening. Is the foot working nicely? What can we do to improve things? All right. On top of that, there's 26 little bones in the foot, in each foot, and if one of those little joints is not working nicely, then that can have an impact on the other ones, and that can affect the way that you walk, and then again impact on the rest of the skeletal structure. I use a technique called activator, which is just a little handheld gadget, and all it does is a little mechanical thrust. So this is really good at working on feet as well. So it does a little punch, and so for something like the foot, we use a lighter setting. It just does a little mechanical thrust. I find whichever joint is stuck, locked in the joint, in the body, and I give it a little thump. Particularly good at working on ankles, so old ankle injuries, but also on metatarsalogia, and we use it to gently adjust the big toe if you've got bunions and things. I do a lot of arches are dropped and collapsed and sitting on the floor sometimes. And I often push those up and get those working better. So mechanically we can improve the function of the foot, okay? And then we go on to doing other assessments. So I have something called a gait scan, which I'll show you in a minute. You walk across a big plate and that maps out electronically what your foot is doing. And then from that we can make an orthotic. An orthotic is an insole that goes into the shoe, okay? The majority of things that I get to see are pronators, and pronating is when your arches collapse, not necessarily just the arches collapse, but the foot rolls inwards, and the knee is a pulley system. It's designed to work in a straight line. So if your knees are working nicely, your knee should flex over the big toe, and if you're a pronator, then that angle changes, and that's a much weaker position for the knee, and as a result of that angle changing, the tibia rotates in, you get a lot of tenderness along the medial joint line. The iliotibial band is often very stiff and tight because this muscle over here, the tensor fasciae lata muscle, is trying very hard to counter the effects of that knee dropping in. So you often get a lot of tightness here, and eventually that'll lead to patellofemoral problems where the kneecap starts to slide over the side and rub like that and cause irritation and erosion of the cartilage underneath the kneecap. And so if you're 4 degrees in, that can change massively the mechanics of the knee. And the gait scan helps me determine how much you're collapsing in and where you're collapsing in and how that's working. ironically, a lot of people who pronate, the body works out that's not a very strong position, so it turns the toes out a little bit, and that's still a twisted knee, but it's a straighter knee. Okay, if you understand. So a lot of people who pronate actually end up having a 10 to 2 position and have their feet turned outwards. And ironically, they wear the outside of the shoe because they slide the heel in and actually wear down the outside of the shoe. So if you've got big wear patterns on the outside of your shoes, if you've got particularly uneven wear patterns in your shoes, if you're getting medial knee pain or patellofemoral pain or iliotibial band problems, and we especially see that with runners, okay, it's a bit like if you hit a golf ball. If you're 4 degrees off, the ball goes a long way in the wrong direction. Same with the foot. If that's 2 degrees or 3 degrees or 4 degrees off, it can massively impact the mechanics of the knee, and then have a knock-on effect further up the biomechanical chain. So we use the gait scan, which is just a little plate that I have over here, and you walk across the plate and it maps out electronically what your foot is doing. I have something over here we can show you. Alright, this is an example of someone, okay, someone who's got not brilliant foot biomechanics, and we used orthotics to help get this guy walking better and have a lot less pain. So good.